Oh, silver.
Good afternoon, everybody. This is the Healthcare Committee. It is Thursday, February 12th, and we are going to have a special discussion with the healthcare advocate. Take it away, healthcare advocate.
Thank you, Mr. Vice Chair.
Health and
Yes, if you haven't met me before, I'm Mike Fisher, the healthcare advocate. Just an hour ago, the chair asked if I could come and spend a little time talking about silver loading. And I, of course, because I'm a glutton, said, sure, why not? I don't need any time to prepare. And so I think if this were to be done right, I would have some slides and we would walk carefully through it. But I think the committee had some time and I am happy to muddle through this with you to try and describe the dynamics that lead to silver loading, the dynamics in which silver loading works. And so I was thinking I would just go way back to 101, Affordable Care Act 101, a few details first. Everybody knows that there's different metal levels and that the metal levels describe on average how much is paid of your care is paid for by premiums and how much of your care is paid for by out-of-pocket costs. So for instance, a bronze plan on average through the whole population, not the Vermont population, the national population, we would expect that 60% of the care is paid for through your premiums every month, and 40% of the care is paid for through your copays, deductibles, out-of-pocket max. Doesn't mean if you go to get care, 60% is going to be sent to you as a copay. This is on average through the whole population, through all the care that the population needs. So that's one really basic piece, building block. The next building blocks are the two different kinds of subsidies that are given in the Affordable Care Act. I'm sorry if this is really simple, but it just feels like it makes sense to say it again. There's two basic subsidies. One of them is the premium tax credit, sometimes referred to as APTC or sometimes referred to as PTC. It's an advanced fund tax credit that comes to you either when you get when you pay your premium, or you can not get it and get it at tax time.
Can we ask questions?
Yeah, please.
Is that state or federal?
Federal, all this federal,
Okay, it's all federal.
all federal. There's a Vermont piece of it, but I'm going to ignore that. I'm trying to make this simple for a minute.
Yep.
The other major subsidy, federal subsidy through the Affordable Care Act, is the cost sharing reduction. And the cost sharing reduction for lower income people gives people a better benefit, a richer benefit, because they're recognized as being poor. I hope you don't want me to start over. And just to say that a little bit more detail about the CSR program, it buys up that actuarial value. It says, even though you're buying silver, because you're between Medicaid and 150% of the federal poverty level, silver would otherwise be an 80% actuarial value, but because you're that poor, we're going to give you 94% actuarial value. So you're getting you're getting better than platinum. Okay, that's the ground. Yes.
Thank you. The cost sharing CSR.
Cost sharing reduction, yes.
So the
yes,
first one I said out loud. For low income. So is that up to, what's the percentage for the federal poverty?
Yep. So the CSR bands go from Medicaid, 138% of the federal poverty level.
Okay.
The first band goes between Medicaid and 150%. And that is a 94 actuarial value. And then there's a band from 200 to 250, and there's there's a number of bands all the way up to 300% of the federal poverty level. But I'm gonna try. Let's not get stuck in the details here for a moment. Trying to stay sort of in the high level. Something happened in 2018. In 2018, the federal government said, the first Trump administration said, we're not funding the CSR plan anymore. Addie just talked about this. We're not going to fund it anymore. Insurance companies, you still have to give it, but we're not going to pay for it anymore. And a group of us got together here in Vermont and nationally and recognized, hey, we have an opportunity to fund the CSR plan, the CSR costs, by putting those costs on the silver level in the individual market. And so that action applied the costs to people who got substantial federal tax credits, and so shifted the cost. The feds ended up paying for it anyway. And that was just for the actual costs of the CSR program. And the feds let us do it. It happened in 2018, 2019. And it was known as the first edition of what's known as the Silver Load. Yeah.
Yeah, no, it's okay.
All of that should be fairly straightforward. Here's where it gets more complicated. I think in 2022, we at the Healthcare Advocates Office noticed that a few states, New Mexico in particular, was taking another step, a fairly aggressive step. And I'll just recognize it was based on some work by a guy named Stan Dorn, who was at Families, who was really promoting it nationally. And we listened to him, and it made a lot of sense. And the logic was, for somebody who's in that high cost sharing reduction band, why are we rating them? Why are we calculating the cost of their insurance like it's a silver plan? It's not a silver plan. It's a better than bronze plan. And so it wouldn't surprise you to hear that the premium for a platinum plan is going to be more expensive than the premium for a silver plan or a bronze plan, because we recognize that higher percentage of the care is being paid for by the premium, not the co-insurance, not the out-of-pocket. And so we said, for those people who are in those top two CSR bands, they shouldn't be rated as silver. They should be rated appropriate to the coverage that they get, better than gold and better than platinum.
So silver actually costs less than a gold plan.
Silver in the regular world, the cost. I should say this carefully. The cost of care is the same between silver and bronze, but silver is going to have a lower premium and higher co-insurance, co-pays. So we made this pitch that we should be rating the people in the high CSR levels appropriate to their actuarial value, and apply that to our individual market, and then take the action of, both assume that everyone else will move out of the silver, and then, as Chair Black said earlier today, with the incredible work of, and I think Vermont did a better job of this than any other state that's gone down this road. of making sure that those higher cost silver plans didn't harm anybody. It only went to, we moved everybody out of the plan that the costs went up for. And I probably didn't describe a key detail that I should say.
Can I give a personal example?
Yeah.
Right, so I'm looking at Vermont Health Connect's rate sheet, right? By the way, one of my favorite things, although it's so tiny, I have to look. So I, myself personally, one person on my plan lost all my subsidies starting on January 1st. My gold plan that Mr. Fisher recommended a year ago, you need to go from your silver that I'd always been on to gold. So my gold plan this year is $1,144
A month.
a month. That's not what this discussion is about.
I'll just, I know what that.
However, if I was on silver, which you would think being a lower metal level, that it would be less expensive because the benefits aren't necessarily as generous, like the copays are higher, out of pockets are higher. That plan is $1,288. So it's $141 more
Or lower
for
value.
a lower value plan than the one that I have. And that's silver.
That's the effect of silver.
That's the effect of silver.
We increased the cost of the plan, the silver plan, that people's income gets benchmarked against to determine their premium tax credits. Yes.
Isn't there a trade-off though, which is that for metals besides silver, there's no cost sharing reduction, but for a silver loaded plan, you have a higher premium, but you have much lower cost sharing?
So you're right. I didn't cover this detail when I was talking about the different benefits. The cost sharing reduction is a benefit that's available to people in silver only. The premium tax credit, while it gets benchmarked against a particular silver plan, you get to go buy any metal level you want with those dollars.
Right. So then, so what ended up happening, I'm not an expert on this. I'm doing this more to make sure I'm understanding it. So this isn't me testifying, it's me trying to summarize it. Okay. So you can be like, no, and tell me like what it is. Like, so, but it's like the silver plan premiums went higher and the cost sharing reductions were made for those plans. But then because that premium is so high, that was used as the benchmark, but it's the second most expensive silver plan in an area, correct?
Mm.
That they go, so it's not the most expensive silver plan, is this something like that?
Other side, second lowest cost silver.
Second lowest cost, can you explain that?
Not the lowest cost.
I see, so it's not the second highest, it's the second lowest,
Yeah.
okay, yeah, okay, so then the second lowest option in Vermont, there's two, correct? There's MVP and Blue Cross.
No, there's just one in the marketplace. It is an MVP plan.
Oh, there's only one silver.
The second lowest cost silver plan in the whole market, not by carrier.
But in the whole marketplace, that's a silver, right?
There is a silver, another standardized plan, a silver that you can combine with an HSA, which is actually more expensive. That makes it that the most expensive, and then the other one, the second.
So this is what I'm trying to understand is like, but it's a silver plan that the benchmark's in. It's the second lowest silver plan in your marketplace is the benchmark. And then from that, they calculate your tax credits, which is why someone with a bronze plan like me, just to put an example.
Daisy is shaking her head. I was saying, when I sat down here,
I had it Deb, and Deb is like blank, totally blank.
It's hard to understand. That's why I'm repeating it back because I don't fully, I've heard this for years.
Brian, let me try and describe, and I'm just going to get myself in trouble. So let's do it. We're going to muddle through this together.
Okay.
To come up with your premium tax credit, you take your income or family income and you multiply it by whatever percent of income the Affordable Care Act says that you should pay. So maybe it's, if you're lower income, let's say it's 2.5% of your income. And so that is the amount that the Affordable Care Act says should be your family contribution. And then you apply that to the second lowest cost silver plan. And the difference is the amount of premium tax credit that you get to go. So let's
On any plan,
on any,
which is why my bronze is only 30 cents a month right now.
right? How much?
An $800 and something plan, I'm only paying 30 cents a month. However, I'm afraid that I'm gonna owe money because they're factoring in tax credits, right?
they are.
Yeah, so I'm like, uh-oh, I'm gonna be screwed if these things don't pass soon. Sorry to say
Remember,
screwed.
we're on live.
Well, whatever, I'm gonna be.
So-
I thought of a worse word, but.
So let me try and go back to, instead of going all the way down this rabbit hole, there's a lot of details here, but let me try and go back to the basics of this. We followed the rules as laid out by CMS and applied the appropriate rating to those silver plans that because of the cost sharing reduction are a much higher value and applied that factor to the entire silver across silver. And that boosted the cost of silver significantly. And then we made sure that nobody was left in silver who didn't need to be left in silver. So the only people who are left in silver today are people between Medicaid and 200% of the federal poverty level. And we, in effect, drew down, I think the number is $53 million of federal dollars to help people afford their health insurance. And we've done it for 2 years. We did it for 25 and for 26. And it worked exactly like it was predicted to work. And it's been an incredible affordability benefit for Vermonters. And I'm sure let me just say to the atmosphere, to the YouTube world, this is my best understanding of it. I've spent a lot of time on it and I think I'm right. I'm confident I'm right. But if somebody says, oh, it didn't work exactly that way, I want to hear it so that I can come back and correct. But that's my understanding of how this is working.
Go ahead.
So if a person is receiving premium tax credits currently and Congress doesn't act, are people gonna suddenly owe in their taxes hundreds of dollars because they didn't pay it towards their health insurance?
No, there's no act of Congress that's needed to continue today's premium tax credits. It is funded. There's yes.
Well, so what was the thing that maybe I'm like thinking of the wrong, what is the thing we needed them to renew?
So
City versus tax credit.
Okay, yes, yeah, this is what we know.
there was what we dubbed the enhanced premium tax credits
Okay,
that were passed originally in ARPA, which was significantly more generous. And those enhanced tax credits expired at the end of last year.
So there's enhanced premium tax credits, and subsidy, 3 different categories.
And cost sharing reduction subsidy. But the first one you said, the enhanced premium tax credits are a thing of the past. I don't think you need to understand them anymore.
Not understand,
Our-
just distinction, yeah.
our marketplace folks are calculating this all for us behind the scenes when we get our bill. Like they're like based on your income taxes, they're like doing this for you. And so without that federal policy, without those tax credits, working people would be paying hundreds and hundreds of dollars more for their insurance.
$1,000 more.
Thousands. That's actually, yes, over the course of a year, yeah. It just seems so complicated.
Yeah.
So the silver plan is used as a metric or something
Mhm.
to measure to establish certain benefits. What plan do people end up? Is it like a gold platinum equivalent?
So what people buy the plan that makes sense that they decide to buy. I mean, they're in the marketplace and they make the decision and if they're thinking rationally, I should pause, not say it, maybe I shouldn't say it that way. One might think that somebody who expected to have a lot of healthcare expenses, maybe they knew they were pregnant or were planning to get pregnant, or maybe they knew they have a chronic condition, or maybe they, they just know their healthcare needs, know they have ongoing needs, would tend to buy a richer plan. And so they might buy a gold or a platinum. Equally so, I'm 28 and I'm feeling fit and I'm not worried about this stuff. I want to be protected. I'm going to go buy a bronze. So they can choose to go buy whatever level plan fits them and their family's needs.
And do they get the cost sharing reduction?
They get the premium tax credits for whichever plan they buy. The cost sharing reduction is just limited to silver.
Just silver.
Yeah.
So I actually have to be on silver to get them.
Yes.
May I ask you about something that's like a related but related topic that Addie was in talking about today?
Yeah, can I just say before we leave it, there's a lot of discussion nationally about whether states are using the silver load to adequately pay for the cost of the cost sharing reduction benefit. And Vermont and a handful of states, as I said, went further. And so maybe I should just say, I think there's a decent likelihood that the federal government is going to close this door to us. Which would be too bad, and it'll hurt Vermonters and a handful of other states.
Can I?
Yeah, go ahead.
This is just to make sure I understand the language, because it's a
Mhm.
glimmer, and
Mhm.
that's more than it's been. So I appreciate that a lot. So I hear the enhanced premium tax credits are gone. I hear that the federal subsidy is gone, so those two are gone. The premium tax credits still exist, and that's federal.
Yes.
And then the cost sharing reduction for the silver loading is only at the state level.
No, and the federal law around cost sharing reduction remains, and the funding, and we have fashioned a way to fund it.
But it has to be funded at the state level, even though it's a federal law.
We continue to raise the money for the cost sharing reduction through the silver load. And I don't hear a contemplation of eliminating that. But because of the way that we're applying the cost of it, it ends up being paid for by the federal government.
Okay. Thank you.
So not on the agenda, but Addie was talking today about a basic health program. Wondered if you had any thoughts about whether, because she was talking about it, I'm like, that sounds like Catamount.
Yeah,
You were around in Catamount, I know that.
it might sound like Catamount.
The premise of it, or the
Yeah.
idea
I
behind
mean, I
it.
think it provides for an opportunity for us to give an added benefit to people between up to 200% of the federal poverty level, and a Medicaid-like benefit up to 200% of the federal poverty level, and pay for that with the federal premium tax credits that would have been given to Vermonters had we not done it. And so the reason why your question really fits with this conversation is, remember, the whole silver alignment was based on right pricing people below 200% of the federal poverty level. And so the basic health plan mechanism and the silver alignment mechanism don't work together. If we do basic health plan, nobody will be in the exchange below 200% of poverty and will get no loan. we have been sort of grappling with this question for a while. If we have, let me just say it. Remember, the silver alignment benefit goes to any Vermonter who gets premium tax credits. So up to 400% of the federal poverty level. The basic health plan, and it's worth, we think, around $53 million. The basic health plan would be a substantial, incredible step forward for Vermonters under 200% of poverty. And I don't know the exact value of it to Vermonters, but I think it's a lot, and to that smaller set, that lower income set of Vermonters. So comparing the two things is difficult because they apply to different populations. You know, let's just imagine for a minute that they were both worth $53 million. There's sort of a policy choice that could be made. Hey, do we want to spread this $53 million over all Vermonters under 400% of poverty, or do we want to apply it? So I guess what I mean to say is it's not an easy choice to compare that. But if we are losing the silver load, that choice, in my mind, gets very simple.
So if we lose the silver load, if we explored a BHP waiver, would that be detrimental in any way other than what would already be detrimental to the 200 to 400? Or would it have no effect on them?
Here's a question I should know the answer to. The first part of the silver load, the part of the silver load that's to pay for the CSR costs. How would the basic health plan impact that? And as I'm saying that out loud, I don't think, I'm just going to put that on the table. That's something we need to grapple with. No, I think if we lose I tend to call it silver alignment, the part of silver load that was really designed to bring down costs. If we lose that, I don't think basic health plan or not basic health plan has any impact on people above 200%, between 200 and 400%.
Great.
But aren't you taking them out of the marketplace, you're putting them somewhere else?
Okay, thank you for saying that. Thank you for saying that.
Say, because that might have a.
Thank you for saying that. I think that the detractors of the basic health plan would recognize that we'd be pulling lives out of the market, an already very small market. And what's the consequence of that?
I mean, I do like that plan. It does sound like Catamount, except there's no premiums, like, I think.
No, I mean, we would be getting them substantially better coverage.
I'm killing the market, sorry.
Well, the association
Not
has plans.
necessarily. Not
I
necessarily.
hope not.
There would probably have to be a great deal of actuarial analysis on.
I think you would have to hear from the carriers about their perspective on basic health plan. I think, in my experience, the MVP is very familiar with it. They live with almost on steroids basic health plan in New York. And so, in my experience, they're comfortable with it. I think you'd want to hear from Blue Cross too. I don't think there'd be strong opposition, but I could be.
First, this might not even
Yeah.
be the right. The 1332 waiver that she
Mhm.
Addie mentioned with the about leveraging that premium tax credit.
Mhm.
Does that have anything to do with? I don't know.
So I think Addie said this morning that the basic health plan is not a waiver. It's an entitlement. It's something that is a state option.
The basic health plan is a 1331 waiver. The 1332 waiver is the reinsurance.
So
Get your waivers straight, Mr.
So 1332 waiver is a waiver from the Affordable Care Act. And an 1115 waiver is a Medicaid waiver. And to be honest, I had never heard of a 1331 waiver.
Abby said that the 1331 waiver is the PHP.
Yeah.
That's, yeah.
Yeah. But she also, I heard her say this morning, and I've heard it characterized before, it's not something that, it's an option for the state. Not so much of a waiver, but an option.
Did you have, I think Val asked you, however, about the 1332 waiver, which is the reinsurance. Do you have an opinion on that? I think you've already given your opinion, didn't you?
I don't think I have. I think the right answer to all, the version of the reinsurance language that's in whatever bill is in your committee, 585 is Topper's bill, is to allow the state to go price it out and evaluate it and come back to you. And so I have absolutely no problem with, I think that's a great idea. I have very strong suspicions that it won't make sense. But I'm happy to see the numbers. Yeah, it makes sense for us to see the numbers.
It was a recommendation on their technical analysis. So. Anything else you want to opine on? Thanks for doing this shorthanded. See, clearly, lights are loading.
And I should say, I'm happy to
Healthcare, we wouldn't have to.
sit down with you individually and walk through it again. and
So
again
who
and
makes
again.
it so complicated?
You know, it's like the old farmhouse, you build a little bit, and then you build a little bit
Oh,
more,
yeah.
and you build a little bit more, and you have to do a renovation on the first part before you.
That I understand. Thank you, Mike.
Thank you.
We'll be back at 2:00.